A question that I'm faced with a lot of times from patients is, what's the difference between fillers versus fat grafting? And it really is about addressing volumization. As we get older, or some people just genetically, we lack fat or we lack volume in our face in certain areas. Fillers consist of pre-formulated products that comes in a syringe that we can readily inject. There's no downtime, there is no recovery time, and there are different types of fillers for different locations and the kind of expectations that patients are looking for. But this is certainly what we call a bedside procedure, meaning it's non-surgical, versus fat grafting, which is being able to harvest fat from your body and transferring it to certain locations of your face or body that requires it. Fat grafting is really great, and it is the gold standard for volumization, especially large surface area. So if somebody's face is really hollow and requires multiple locations that need volumization, such as the temple, submalar region, a lot of area like along the cheek area, then fat grafting really is a better solution because it is actually a permanent solution to volume loss in that fat cells are living cells. So when we actually detach it from, let's say, your body, such as your stomach or your thighs, and we insert that into our face, if the blood circulation sort of flows through that graft, then it's actually a permanent living cell that will populate the volume depleted area of your face. Only thing about fat grafting though, that is different obviously than fillers, we do have to harvest from your body, and that requires anesthesia. A lot of times we don't really need general anesthesia, and twilight sleep, which means IV sedation, is more than enough. However, it still does require a usual pre and post-surgical sort of care, and that does mean recovery time. For a lot of people, in about a week, they're pretty good. So the way that we like to talk about who's a good candidate for fillers versus fat, it really is about, number one, whether a patient is willing to accept surgical solution versus non-surgical. The second really is, how much of a volume do we really need to replace? If it's just a small area, then certainly I think fat grafting is an overkill and filler is more than enough. And then if somebody requires filling of like lines, wrinkles, such as, let's say, smile line, the nasolabial fold, then filler really is more superior in terms of results, as well as obviously convenience. Now, who really aren't really good candidates for fat grafting? Even if they're okay with surgery, if they don't really have much fat in their body and the source of fat is really limited, then fat grafting is really not a very good alternative for them, and therefore filler is better. So it really depends upon patients, and that's why a full in-depth consultation with a doctor is really necessary to be able to kind of talk about the alternatives, the pros and cons of each, fillers versus fat.